Okay, I'd like to call the meeting to order for the Deschutes County Commissioners for September 18th, 2024. Commissioner DeBonne is on an excused absence. Let's join us with the Pledge of Allegiance, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And let us go to citizen input. Rondo.
Morning, Commission. Um, I'm Rondo. I've lived in Bend for 35 years, and I just want to continue to express my disappointment and also my expectation that the conversation that I feel like it was a promise from this commission 2 weeks ago. Looking forward at that time to the next day meeting with City Council, and that we were going to be discussing dirt world solutions, and in a direction that I never thought I would ever ask the county to have. And I'm hanging out there. I feel like by myself, waiting for that conversation to catch up to now my expectation of having that conversation. So I'm asking, please, we can get this community excited with something new that they haven't heard before, which seemed like what the promise was 2 weeks ago. Thank you very much for your continued consideration on this, and go Beavers.
Go Beavers. Oh, that's good. We have to have balance in the room. I so appreciate that because I was talking about the Ducks before the meeting started. So, yes, when you've ridden in a duck wagon with mules pulling it, rather unusual experience. So last year they had the most beautiful percherons pulling the wagon. This year they got the mules. So I learned a whole new lesson at the back of the Pendleton Roundup. All right. Anyone online with a raised hand, Stephen? No, no one? Okay, no one else is in the room then that wants to speak. All right, then let's go to our consent agenda.
Move approval of the consent agenda.
And I'll second that motion. Any further discussion? It is nice to see that we do have funding for 1.5 FTE for the district attorney's office. So thank you. Calling for the vote, Commissioner Chang?
Yes.
And the chair votes yes. So first action item, number 4. Kathleen, so nice to see you this morning.
Morning, Commissioners. My name is Kathleen Mann-Coop, and I'm with the DA's office as a management analyst, and I'm here to request acceptance of the Criminal Justice Commission's Organized Retail Theft Grant and consideration of the resolution 2024-042 to add 0.2 limited duration FTE to the DA's office.
I know, didn't they just have a theft that was big, huge theft that was arrested in Deschutes County? I think I heard it on KPND the other day.
I was on vacation, so I missed that one.
Okay, yeah, no, they arrested, I think it was like 22 people or something. It was a big one. Yes. So
Yeah, it was a big bust. It made me wonder whether we need the grant anymore. Tongue in cheek.
And so this proposal, I'd come to you about a month and a half ago. We received approval for our request, but at a reduced amount. It's a partial grant because we didn't have an established relationship with one of the retailers. So we have until December to establish that relationship. We are pretty confident that we will have a relationship established by then, and then we can ask for the rest of the funding. So we've received funding and through the end of this calendar year. And the 0.2 is for additional hours for my position to be able to provide that additional program support until the end of December, and then we'll reapply for the rest of the funding.
And is that next phase a non-competitive if as long as we've got the retailer relationship then?
That is my understanding.
Great.
We'll have to officially apply, but it is my understanding that they've set aside the money, assuming that we will be successful.
Well, I did think that was, yes, hearing about that one theft, that was a huge ring. So I have a feeling, and I'm glad that we actually brought it off of consent the other day and let the community know that we really are paying attention. So, and thank you for what you do.
That sounds like that might be a good retailer to talk to about having be our formal partner.
We'll look into it.
Amazing. Because I think the head person, they had not arrested the head person. They were looking for him, the ringleader of the ring. So is there a motion?
So we need two motions.
That's true.
Move to accept the grant award and authorize the county administrator to sign grant agreement number ORT-25-04 between the state of Oregon acting by and through the Criminal Justice Commission and the Deschutes County District Attorney's Office.
And I will second that. Is there any further discussion? Commissioner Chang?
Yes.
And the chair votes yes. All right, so then we need a motion for the resolution. A second.
Move approval of resolution number 2024-042, increasing appropriations and adding FTE within the 2024 to 25 Deschutes County budget.
And I'll second that. Kathleen, what was the total amount that we will get on top of this? If we are so fortunate as to establish that relationship.
It was, I think, just under 50,000. We've gotten just under 18,000.
Okay. All right. All right. So calling for the vote, Commissioner Chang. And the chair votes yes. So thank you so much. All right. We do now have item number 5. Let's see. Janice, good morning.
If she needs it. Good morning, Commissioners. Janice Garceau, Director of Health Services. And Brenda, do you have the presentation available or do you want the flash drive? Sorry, I was going to call it a jump drive. That's how old I am. Okay, I'm going to let you introduce yourself really quickly and then we'll get rolling.
Great. Morning, Jess Nyworth. I am a supervisor with substance misuse and problem gambling prevention in the prevention health promotion team in public health.
Thanks, Jess.
And we are here, Commissioners, this morning to move approval of recommended use of opioid settlement funds. If you recall, in 2021, a nationwide settlement resolved all opioid claims brought by states, including Oregon, and local political subdivisions, awarding $26 billion for distribution over 18 years. The settlement amount for Deschutes County is expected to be roughly $7.1 million over that period of time, although that amount does seem to be adjusting as other settlement dollars come in, which is part of the reason we're here today. On July 17th, we presented with Community Justice a proposal for use of some opioid dollars over a 5-year period amounting to $3.4 million for a multi-strategy plan that involved adding targeted expert overdose use disorder prevention, increasing coordination of surveillance and overdose prevention activities, sustaining existing crisis interventions, adding direct coordination of services to forensic populations, and adding recovery peer services. At this point, we're aware that there are some additional settlement dollars that have become available, and we're requesting an additional $168,000 of those dollars over a 5-year period, which would add $80,000 for access to life-saving naloxone medication supplies, $40,000 to increase surveillance support through an overdose dashboard, and $40,000 to support additional robust public communications and a specific campaign that Jess will talk a little bit more about. 5% would be used to cover indirect costs. That's what's allowed. So if we can bring the presentation up, we'll get into some details about what we've been doing and what is planned if the funds are awarded and approved. Yeah. So this is just a reminder that when we presented to you a year ago, we were proposing a 5-year strategy that involved targeted prevention, surveillance and coordination, and intervention and case management. And all of that was to address the crisis in our community of opioid use and opioid use related overdose deaths and emergency department visits. What we're going to focus on today is our expanded coordination of surveillance and prevention activities, because that's what we're requesting funds to add to and continue certain activities. Next slide. Oh, you're there. Thanks, Brenda.
I'm running it.
Oh, you're running it.
Yeah.
Wow, it was like magic.
She read
So-
your mind.
We had specific goals for our prevention strategy, and that was to improve awareness and utilization of resources and effective strategies to prevent overdose and use, to prevent and reduce adolescent and young adult drug use, to improve coordination with internal and external entities working to reduce overdose deaths and harms, and to ensure real-time surveillance. And that's a system that we've been building and working on to quickly respond to overdose information locally. The 5-year costs are listed there. That was the original award amount over the 5-year period. And I'm going to turn it over to Jess to talk about what we've been doing, what goals and actions and activities have been completed, and then what's proposed going forward.
Should we go back up? We'll go back just one. So this is quite a busy slide. Apologies for that, but I wanted to give you an update on deliverables to date and where we are in our progress for all of those deliverables that the prevention health promotion team is committed to. So we, in November of 2023, did establish a surveillance tool to communicate overdose deaths in a timely manner in partnership with the medical examiner's office. So within 48 hours of an overdose death, the medical examiner sends us a report of the fatality that we're able to track closer to real time. As you know, surveillance in any sort of coming through our health systems often will take 6 months to 2 years to get to us. So this is a greatly reduced amount of time between when we are able to hear about fatalities that happen so we can respond well. We have also set up an internal coordination plan for surveillance and response to overdose alerts. So essentially, if there is a spike in doses in a certain community, in a location, geographic area among different age groups, we're able to track that, as well as have put together a spike response plan to, as we did in January, was our first public communication about a overdose response we've had in the county. So it's about internal communication as well as external communication about a response plan. We have met with a number of community organizations that are involved in that response, and we're meeting with them again in 2 weeks to help them come up with their own internal emergency response plans that communicate more efficiently with the counties. We also developed a website and how to receive naloxone training, where to access naloxone and other important information and resources. We launched that as deschutes.org/stop-overdose. We have ongoing communication and awareness through multiple media strategies and audiences with widespread county reach. We launched those initial messages using existing collateral in February February of 2024. And we have a new campaign collateral to be launched. It says here mid-September. We had some contracting delays, so it'll be an October launch. But it is a evidence-based, been in practice following all the best procedures to make sure that the messages that are intended to reach those audience actually are tailored to those audiences. So when we're asking people to carry Narcan, to be aware of overdose in their community, that is actually tailored to that specific audience. So they are more likely to hear those messages and act on that behavior change we're looking for. We have two of these deliverables in progress. One is overdose education to a minimum of 10 organizations. We've had 2 of those trainings conducted as our program strategist was hired in late May. And so we have education plan to be integrated with process change technical assistance rather than kind of one-off trainings. Part of those that are coming up is October 1st and 3rd. During Teacher Ed Days, we are training all middle school and high school health teachers on naloxone and resources, and then supporting them as they deliver the new state mandated fentanyl and overdose education curricula supplement. We are working on developing a network of agencies who provide naloxone and ensure access to naloxone in the community. As I mentioned, we have a meeting in 2 weeks with some of those organizations, and then there's future plans that you'll see in our additional budget request about the coordination of those naloxone activities. But one example is we've provided technical assistance to 3 community agencies, one of which is Bend EMS, as they put together a Leave Behind program. So when they respond to an overdose in the community, they have put together a Leave Behind program with education, materials, access to or communication about treatment that's available, as well as Narcan or naloxone to leave with those individuals. We go to the next slides. I'll talk a little bit about our recommendations and requests for additional opioid settlement funds. Thank you. So as
I just have a question.
Yeah.
So someone's overdosing, but they've survived, but you're going to leave them. So does anybody talk to them like from our department, like maybe 5 days later or something and say, have you thought about really getting help? I mean, does anybody do that?
So currently there's a number of ways folks can, we have access to individuals and they have access to us. If they're already connected with services through the community, so they're already involved with, say, the Deschutes County Health Services Clinic, if they're already involved with some of our outreach through the harm reduction program, or if they are already involved through, trying to think of another example.
So I'm going to back up just a little
Sure,
bit.
yeah.
We know from our harm reduction data collection that probably half to 70% of overdose rescues that are reported to our staff don't show up in the ED. So they are bystanders administering naloxone, and that may happen completely out of anyone's awareness other than the people that are saving a friend or a family member's life. So we don't know if everyone has somebody standing by when that event occurs to talk to them about treatment. If they show up in the ED, someone is likely going to talk with them about whether or not they're open to a referral. And there are some in-reach programs that are doing that. If they're working with our homeless outreach services team, if they're coming into the stabilization center, for any reason, if they are working with the harm reduction program, they have opportunities to talk about engaging in treatment. You all are very familiar with the deflection programming that's coming up, and that's programming that will engage folks who are having criminal contacts or contacts with law enforcement as a result of potential criminal behavior or suspected criminal behavior, and they certainly will be receiving a referral as part of that process. So it's a mixed bag. It really depends on who is helping save a life and when, and whether the person is in a position to even be communicating with someone about a referral.
Thank you.
Thank you.
Can I
So
also just
yeah.
insert here. So a couple weeks ago, Matt Christensen came to the Public Health Advisory Board to give a presentation on, basically real-time data or more current data on overdose deaths and emergency department visits for the state and for the county. And at that point in time, he shared with us that it looked like emergency department visits were trending downward, both for our local community and for the state. And I can't help but think that some of these activities are helping to promote that trend of reduced emergency department visits.
So correct. A couple things. I know that there was a request that Matt come and present that data in a meeting before the board, and that work is being done now, and that's planned. So you will hear much more about his data. He's our epidemiologist who focuses on many things, but opioids and use and overdose are one of those things. I'm going to provide a little bit of that information today because I did review that presentation, but across the country, the news is good. For the first time since before COVID, overdose deaths and overdose visits to the ED are down significantly, 15% across the country. And I did some quick math here. It's even more significant in Oregon. So we are beginning to see a decline, and there are some reasons that are being proposed for why that's happening. And some of the prevention and harm reduction efforts are part of that. But we'll talk more about that in a minute.
We are going to have that presentation. It just isn't, it's been scheduled.
Has it been scheduled?
Yes, I believe, hasn't it?
Yeah.
October. Okay, October.
Coming soon.
Yes, any month now. And we're going to celebrate 75 years for Central Oregon Community College too, sometime soon, because 75 years, amazing.
So looking toward to the future, we have a couple of objectives we would like to add for prevention and health promotion to achieve. As you probably know, there is an Exhibit E that all work about overdose response, prevention, intervention, and treatment must be in. And I wanted to note that all work here is acceptable under Exhibit E for how opioid dollars can be spent. And then, of course, are in line with our previous commitments we have made to you. So the couple of objectives we have here. So first, increase the amount of life-saving medication for those who need it. So increase naloxone access in our community. We have made great strides, as have our number of community partners in having naloxone available in the community. But we are seeing a uneven distribution. We actually, because of the great efforts of our harm reduction program, there are a number of folks that are unhoused that have ready access to naloxone. Those of our population that have permanent housing are less likely to have naloxone. So this life-saving medication for an overdose, for an opioid overdose. And we want to make sure that they have access to it. So as part of that, we are hoping to organize a network of agencies that provide naloxone and ensure access to naloxone in the community. One of the ways we would like to do that is through Nalox boxes, as I'll talk about in a minute. But that's an interesting concept that is happening in a number of communities. The second is additional surveillance support. So creating an overdose surveillance dashboard. So we have both internal with more sophisticated measurements of being able to track trends for fatal and non-fatal overdoses, but also an external data dashboard for community. So that anyone in our community can go and look and see what's happening with overdose and in our Deschutes County. And the third is increased ad placement for our new campaign and further our public communications efforts to expand on ongoing communication and awareness strategies through the placement of multiple PSAs, public service announcements, and education materials. So if we move to the next slide. Yeah.
I just want to tie those efforts to what some of the emerging data is showing. The the folks at the CDC that are tracking overdose deaths and tracking this trending down phenomenon that's occurring are attributing it to partly, finally truly coming out of the COVID-19 pandemic crisis period. They are also tying it directly to the availability of harm reduction supplies and to prevention messaging. So these objectives are really aligned with what we're seeing emerging evidence showing to be effective in decreasing deaths and ED visits for overdose.
Thank you. So looking at this first, sorry. This increased naloxone access in the community. Ideally, what we would like to do is purchase the medication itself, so the naloxone or Narcan itself, for distribution in the community in partnership with community partners. So we want these Nalox boxes. There's an image here on your screen of an example. It's free, publicly available, and placed in key locations around the county for individuals with high risk but low access to Narcan, which typically ends up being folks in rural areas or young adults, and making sure that they have access to naloxone for free in a way that they aren't having to seek out specified care associated with them asking the really uncomfortable question of a medical provider of, can I have some naloxone? And so this would be able to reduce some of the stigma of accessing naloxone in our community to reduce some of that overdose. We're looking to also improve the capacity of bystander rescues. So those who have loved ones or friends, family that are currently using opioids or abusing opioids and aren't ready to get treatment, and they want to make sure that they can keep them alive. And so could have ready access to naloxone in their community that they can get as a bystander and help save the lives of their friends or family. There have been a number of folks, or a number of locations around the country, as well as in the state of Oregon, that have put Nalox boxes in their communities and have had great success. Actually, I have a quote here that a layperson rescue with naloxone has a 98% success rate. And we're seeing that pop up in multiple communities that have these Nalox boxes that are readily available. We plan to do this in collaboration with Deschutes County organizations that receive naloxone already from OHA, knowing that it costs quite a bit to stock these Nalox box kits. And we are in partnership, so we are not bearing all of the cost of putting this naloxone access in our community, but are partnering with those who are embedded in our community and have access to naloxone through OHA as well.
So who are those partners then?
So there are a number of partners who already are receiving funds from OHA through the Save Lives Oregon clearinghouse. But we don't have formal commitments with any of them yet. So I don't want to name names. But because we wanted to ask to you all for permission to do this objective in this way. It does come with a cost associated with startup costs and making sure we're, bringing some of the materials to the table. But there are a number of agencies we've already talked to that are interested.
Service providers, shelters potentially.
So, yeah, shelters, service providers around the community. Also, we've been talking to public libraries to make sure, because this is a community space that multiple people access.
Can I ask a couple of questions just about the nuts and bolts about how this works? So, this isn't like a fire extinguisher where you like break the glass and you pull it out. Like it looks like you could just open and close this.
Yes.
And so, I mean, do some people use it, not just in an emergency, but, oh, I should be carrying naloxone. There's a box. I'm going to go take one out and stick it in my pocket and then close it back. So
Absolutely. That is the hope and purpose, is that folks who are in the immediate vicinity who need access to naloxone to respond to an emergency do have access, but also that bystanders are able to carry and get easy access to naloxone they can carry on their person and bring with them to locations they may need it in the future where there is an emergency.
Got it. So it's not like you're trying to get these boxes in every kind of location where there might be, an overdose emergency. It's basically like a supply box, like a centrally located supply box, and you're replenishing it on a regular basis.
Yes, well said. Thank you.
And then, so it looks like the bottles these are nasal spray bottles in the box here.
Yes. Yeah. So that's the intention, is to have nasal spray, which is, predominantly people prefer over other methods of naloxone administration. So nasal spray plus information about how to use this product, how to access services, and information about the Good Samaritan law, so that if you need to call emergency services, you are protected from drug-related charges. So please call emergency services to get further access, further support for the person experiencing an overdose.
Great. Thank you.
Mm-hmm. Okay. Moving to the second component, we're looking at a surveillance dashboard, and we've been talking to our data analytics team internally. But essentially, it's to use our existing surveillance tools. We have a number of those within the county to monitor all of our data sets. We're getting a number of data sets since we started this work through health services, both from the medical examiner's office of fatalities, from emergency, from EMS, through the Essence system, as well as ED visits and hospitalization visits, the harm reduction program. And we're also in talks with local law enforcement to see how we can incorporate that data as well. So there's a number of data sources that are coming in, and to have them all mapped with these data sets together so we can better see trends and identify spikes. So having it automated will help us better respond and more quickly respond to prevent further overdoses and to prevent fatalities. Part of this we are doing internally is we would like to layer social determinants of health and hotspot mapping. So looking to see what are some other things happening in our community that may be contributing to increased opioid use or abuse or other substance that folks can overdose from, to better equip our responses in the long term, as well as in the short term and spike response. So we're also looking to do some public information sharings. Like I mentioned, we're actually envisioning 2 dashboards, one internal with to monitor trends and mobilize a rapid response with more information, and then one that's community facing to share non-identifiable data with public and the media. And then I put a note in here. Local public health departments that have community-facing dashboards have reduced their data inquiries by 80%, because folks can find this information more readily and publicly available, and we're being very transparent about what is happening in our community. And this also will help us to inform equitable prioritization of our work. By layering that social determinants of health data of what are the influencers of health in our community, we can map services that are available and identify gaps in services. So where are there gaps in our community where there aren't good access to healthcare, or there's not readily available naloxone? So we can better see and respond to high burden populations with long-term and sustainable solutions. Yes.
Just a couple things. One is we've already been using real-time data for probably the last nearly year as part of our opioid surveillance briefings that we're doing and internal efforts we're doing to target certain areas of the community for intervention. So this is something that we're already doing. This allows us to organize that data more comprehensively and layer it with social determinants of health data collection that we're also beginning to do. The other thing to know is that I have a 30,000-foot view on media requests. And with the exception of houselessness, opioid data is probably one of the most frequently requested data points for us. And it's a considerable amount of staff time spent often just reporting very simple data that a public-facing dashboard really might help mitigate and save time and just help a community at large have a view on what is happening in their community that's factual versus rumor-based, which we think is a helpful tool. So.
Thank you. And so the third objective is increased public communication. So with our current budget allocation, we're adapting a state overdose campaign out of Washington State for Deschutes County audience. And we have funding to place a limited ad run, both in digital display, social media, streaming audio, radio, and billboard. But additional funds would support a more robust ad run in local cable, streaming TV, and a more targeted digital display for key audiences. I included a couple snapshots here of what the new campaign will look like. Like I mentioned previously, this campaign is called Friends for Life, was developed out of Washington State and is incredible. They have other states and other counties and communities from all over the country asking to adapt their campaign because it has been so successful, increasing awareness, but also reducing the stigma associated with carrying naloxone as a bystander. And when we think about what we want folks to do in this behavior change, we want to prevent folks from abusing opioids. We want to prevent opioid overdoses, period. And we want to prevent fatal overdoses. And carrying naloxone will help prevent fatal overdoses, as well as increase the awareness of folks of what resources are available if they are already using opioids and want to seek help and treatment and support. And so the last slide is just our budget allocation. As you'll notice, some are steady across years. Some are varying. The access to life-saving medication, so those Nalox boxes, we anticipate rolling out in fiscal year 26, but with some startup costs as we roll out kind of some initial efforts in fiscal year 25, as well as other naloxone distribution that we're doing in the community in partnership with our harm reduction program. The dashboard is a cost the first year, and then it's just maintenance. The public communication, we would like to have continuous over the next 4 fiscal years. And we align this budget with our 5-year commitment with public health prevention, health promotion to the BOCC.
And last, I had promised to share a little bit of good news. In Oregon, and consistent with some of the national trends, but actually trending more positively, overdose emergency department visits peaked in August of 2023 at 646 statewide and declined to 339 in July of 24, which is roughly a 48% decrease. That's pretty profound. And I do think very much related to targeted, focused efforts to both get the message out about how to prevent overdose, the Good Samaritan laws, which make people willing to reach out to the ED if somebody is in fact in an overdose situation and needs medical help, and to some of the awareness campaigns and prevention campaigns as well. Another piece of data that was interesting to me is that we monitor our local wastewater for the presence of opioids and methamphetamine and other substances in our wastewater. And we have seen a decline in that presence that looks to be about a 50% decline over the last year. So that's good news. The downside is that methamphetamine continues to be present at the same level, and we trend higher than the national data for methamphetamine. So that's still an area that we need to be thinking about and focused on, especially given that the methamphetamine supply now is often also containing fentanyl, and just a huge added risk for both addiction and overdose deaths.
Yeah, when when Dr. Christensen shared that local wastewater data, I was really interested in that. I said, well, but if people aren't kind of engaging with the city wastewater system, going to the bathroom in places where there's plumbing, then you're not going to pick up what's in their system. And that got into a whole kind of more in-depth discussion about who is who are who's who has substance use disorders, who is having overdoses, and I was really surprised to hear that the overdose deaths, a lot of those people are, there's a a perception in our community that all the people who are really addicted, who are overdosing, are homeless, and he shared that the vast majority of the overdose deaths were housed people. So so that kind of made me worry less about how important it is or relevant it is that levels are in wastewater are going down. So,
Yeah.
and just, it was just a reminder, an important reminder that, if we have 1,500 homeless people in Deschutes County, and we have tens of thousands of people who are struggling with substance use disorders, then, it's not just a homeless problem.
No, it's not. And you're correct that, just provided data to me last year that confirmed that the overdose deaths we had seen in a certain period of time were almost all housed individuals. So I do think there's a lot of myths about where drug abuse and substance use is occurring. What we know is it's occurring all over our community, both in homes and in encampments and everywhere else. And the other thing that was interesting to me is that we're trending higher for methamphetamine use in our wastewater, which says something about who is using methamphetamine, and the fact that wastewater is coming from properties, from housing, and not from encampments. So I just think there's lots of helpful information for reducing stigma, both for homeless individuals and for people struggling with addiction.
So what is the overdose number that you have available for this year? Do we have a number at all? I know last year we would get the number from Best Care. It was 26. They lost 3 people in 1 week, and these are people that Best Care was working with. And that's not just Deschutes County, that's Central Oregon. So I thought I'd heard from Rick, and his number was like 3, I believe, the other day when I got a number from him.
Yeah, Dr. Christensen, he shared, because we have much more real-time access to medical examiner data, he shared that his estimate, his projection was that we would be level with last year in terms of overdose deaths in Deschutes County, which, I also was puzzling to me, because if ED visits are way down, but overdose deaths are flat, then what's going on there. But
Go ahead, Jess.
Well, I was going to say part of what's going on is folks have access to naloxone, and so they're able to rescue and to save the life of a friend, and they may not go to the emergency department.
Right.
They may not seek additional services, and then.
But we're talking about deaths, though. So if someone dies at home from an overdose, they're still going to go into the number system, are they not, when it's determined by the medical examiner?
Yes. So the medical examiner, yeah, does give us those numbers. So they,
And how many months behind are they? Like,
48 hours.
they can do it that fast in 48 hours. Okay.
The other thing, overdose deaths nearly doubled a couple of years ago. They have remained fairly constant since then. And it's early in the year. I don't know that we can talk about trends yet, but I know that Matthew's presentation did say that it looked like we would be about the same this year. The thing to remember is that Deschutes County is not in the top 5 hotspots in
Right.
the state.
Right.
And that is frankly partly because of, I think, the efforts that have been very targeted in our region and that we were doing early on. So there's good and bad news.
Right.
Leveling is better than going up.
Absolutely.
And trending down in some other areas like presence in the wastewater and visits to the ED is really positive.
Yeah, yeah. And I mean, and to your point, the fact that we did not have the incredible surge in rates per 100,000 people that many other counties, Southwest Oregon, Lane County area, Multnomah County, like the metro area, that the fact that we didn't have that kind of a surge was really great in early years. And so the fact that we're level is perpetuate, that we did not go up further and that we are still among the, not in the top 5 or more of counties is a great thing.
Well, especially when we comparing to the metro area is really tough, but when you're comparing to counties like Lane or Marion or I think
Jackson and Josephine,
Jackson
yeah.
County,
Yeah.
those are counties that have a lot of similarity to ours. And so it's hard to even use a word like encouraging in the context of people dying. Of
Yeah.
overdose. But
Yeah.
it is good to know that we are experiencing this unprecedented loss at less intense a level than some other communities are. And we hope that's partly because of the work that's being done.
Yeah. Klamath was up there too. So I
Yeah.
mean, just that whole band across South Central, Southwest Oregon looked really bad.
So I have a question. The 168,000 that's being requested, is that just a reallocation from the original funding? I'm wondering where did it come from?
Came from Dave Doyle made us aware that some additional opioid dollars had arrived.
That's what I was asking. Okay, that's what I was wondering. Okay.
Yeah, and I wanted to follow that. I wanted to ask: is 168,000 the total additional opioid dollars that have arrived, or is it okay?
It is.
I just want to know if there was more to work with for
distributions. So we had to be really thoughtful about what to do with $42,000 that makes a difference a year, which is what it basically, I think, amounts.
right.
That's what it says, 42 a year.
Or over 4 years, sorry, not 5, but part of our 5-year overall strategy.
Mm-hmm. Yeah, great.
Maybe you should have looked at inflation though too, and done it per inflation analysis, just because.
Yeah, hopefully that doesn't have as big of an impact because these are mostly contract and supply expenditures, and those prices have remained fairly stable. Unlike wages.
I mean, advertising might go up some, but hopefully 10,000 or $10,000 will still be buying you a decent amount in fiscal year 28.
I noticed you put billboards down. You're going to actually do a billboard on this? No, I mean, I was just, we had some billboards, 2 years ago about overdose deaths, how bad it was. So just wondered, is this your last slide? Okay. All right. Great presentation.
Janice, did you have any more big picture trends that you wanted to point out, or
No, coming
Well,
soon.
we'll dig in, we'll dig,
We're expert. than
we'll
I am.
dig deep with
Yeah.
that. Yes.
Yeah.
Great. Okay, well, if there's no further questions, I'm ready to make a motion.
Sure.
Move approval of the recommended use of opioid settlement funds.
And I'll second that. Is there any further discussion? Commissioner Chang
Yes.
and the chair votes yes. So thank you. Thank you, Jess. Thank you, Janice.
And really, thank you for supporting this work. I know it can be controversial. I know we've had some hard decisions, and it is life-saving work, and your approvals have been part of that. So we're very appreciative.
It
Thanks.
sounds like the work is making a difference.
It is. Good news.
Yes, I believe it's been called enabling at times. Yes.
Yeah, sad, because it's also life-saving, and really happy to be involved in it. Thank you.
Okay, other items. Are there anything else?
I'll just share, Monday night, the Regional Housing Council met. And that group is basically discussing what might be a policy agenda, similar to what we were doing Monday afternoon, a policy agenda for the 2025 legislative session. I'll also mention that the 8 agencies that put together the expanded prescribed burning pilot in West Bend this spring are planning on doing a field trip of some kind on October 2nd. I asked them if they could start as late as possible in the morning so that we could squeeze in our Board of Commissioners meeting, and potentially all 3 of us could have the opportunity to attend that field trip. But I haven't heard for sure what their schedule is going to be. But for coordination, A, I just wanted my fellow commissioners to know about it, and B, for coordination purposes for our October 2nd meeting, if it's possible to plan a light meeting that day. I would definitely like to participate on this field trip, as just to kind of high level recap in prior years, because of smoke management constraints from air quality regulatory agencies. The Deschutes National Forest has only been able to burn about 200 acres per year average in that whole area wrapped around the southwest and west side of Bend. And this year, because of the coordination between the land management and the air quality management agencies, they were able to burn 9 times that, 1,800 acres. And we desperately need this work to create a low fuel buffer between our communities and the national forest. So I'm super excited about that work. And, I guess my ongoing concern is I want us to be able to do it again next year, and for the next 5 or 10 years to burn that number, to prescribe burn that number of acres, because that's what's really going to help again create this ring of low fuel buffer area around the city of Bend. So when that's my general interest in going on that field trip. It's great to take a victory lap, but it's also really important to push these agencies to say, and how will we do this again next year? Because it took, a massive amount of staff coordination among these agencies. And I don't think that they can put up that many staff hours again next year. They have to streamline, they have to learn lessons, have built relationships and trust, kind of figured out what the key things that you need to coordinate on, and really streamline that process for us to be able to do more in the future.
Thank you for that. And yesterday we did have the Fire Free meeting with a presentation. For the first time in several years, Jenna Dybel gave a presentation. That position had not been filled. She's the assistant professor of practice with Central Oregon Extension Forester. So she did give a presentation to our group, and it was incredibly well received with her analysis. So thank you, Jenna, for being there. If anyone wants her phone number, it is 541-516-0934. I'm sure she'll be happy for me to give it out. She's a welcome bundle of knowledge that our community could use. So thank you. So anything else?
Chair, thank you. I'll just share, since it came up in public comments, 2 weeks ago, tomorrow, is when the Board of County Commissioners and Bend City Council directed staff to begin to work to establish a temporary safe stay area. And so at the staff level, we are working and collaborating very closely together. So while that has not come back to a board agenda and perhaps not a city council agenda, I haven't been tracking their agendas. Just to give you the confidence that a lot of work is happening. And tomorrow is a 2.5-hour coordinated houseless response office board meeting. And I think that there will be an update tomorrow at some point as well. So this certainly remains a high priority for us, given the board's direction. Thank you.
Okay. No executive session today?
There's a
do.
brief.
We do have one.
We do.
Mhm.
Okay. So I believe we need to leave this meeting then, and you need to do your reading.
I could read the announcement first and then we
Yes.
recess. The Deschutes County Board of Commissioners will now convene an executive session pursuant to ORS 192.660. The specific authorization for the executive session is ORS 192.660 subsection 2E, which allows the board to meet in executive session in order to discuss real property negotiations. Designated staff and the media are allowed to remain during the executive session. However, the media may only report that the board met in executive session and the identified basis for meeting in executive session. Recording devices are not permitted. No final decisions will be made in executive session, and at the conclusion, we will open the doors and invite the audience back to the meeting.
Okay, thank you, Stephen. We're reconvening our Deschutes County Board of Commissioners. We have had our executive session and we will now adjourn our meeting. I do believe we have a meeting Monday afternoon at 1 p.m. next Monday. So, see you then. Thank you, Steve.